All right, good afternoon, everyone, and welcome to the second of six business information and listening sessions presented by the Wyoming Business Council. I'm going to cover a few housekeeping matters before I hand you off to Josh to introduce our agenda and panelists for this session. Written questions may be submitted using the Q&A function on the webinar toolbar. We will share these with the panelists as time allows. Please do not submit questions via the webinar chat box. Those do sometimes get lost. Any individuals wishing to speak or ask questions should utilize the Raise My Hand feature on the webinar toolbar. Please keep your microphone muted at all times when you're not speaking and keep background noise to a minimum. This is a courtesy to all participants and will help ensure we have good audio on our recordings. Speaking of, yes, we are recording today. We will make the recording of this session and all the others available on our website, wyomingbusiness.org, as soon as possible. With that, I will hand you off to Wyoming Business Council CEO Josh Durrell to introduce our speakers and today's agenda.
Thanks, Warren. Appreciate that, and I appreciate everyone joining in. It looks like we've got about 100 participants or so, and I imagine we'll get quite a few more. As Warren mentioned, we're going to do a number of these sessions this week to help everyone understand the new orders that are coming out and how they'll affect you on May 1st. And Warren, if you can, maybe I'm not seeing it, but go ahead and just jump to the next slide. And then one of the things that is really key, I think, with all of this, and we all know that this is quite an interesting experience over the last few weeks, and it's impacted businesses, it's impacted our lives. And I can tell you from being involved in the state agencies for a short time that there are just a number of really great people who are working extremely hard in order to make the best decisions to really balance the idea of lives and livelihoods, because we do realize that public health comes first. We're going to do this in a metric-driven way and do our best to get back to some semblance of normal. And while we say the word normal, I just want everybody to understand that, of course, it will not be the way we were a few weeks ago, and that we should all be willing to collaborate and be creative with our customers, with our own businesses, and with our communities in order to make this work and really to help get through this, because it is going to be a challenging time for time to come. And I do have a number of great folks available today to answer your questions. As the Business Council, the thing that we wanted to do more than anything was to be able to be here for the businesses in Wyoming and listen to your questions and hopefully provide some answers, so that as you begin to open up your doors and take more customers, that you would be able to do that in the best way possible and do it as smoothly as possible. And so to that end, we put these webinars together and really brought in the experts in order to get the word straight from the horse's mouth and understand it a little bit better and answer some of the nuanced questions that I'm sure that you all have. And so we've got at least these folks on the phone: Stephanie Pyle, who's the Senior Administrator, the Public Health Division of our Department of Health. We also have from the Department of Health, Stefan Johansson, who's the Deputy Director. So he'll be available for questions as well. I believe we have Sharon Bennett on the phone. She's the Executive Director of the Wyoming Board of Cosmetology. And then we also have in Corin Schmidt's stead, we have Nikki Anderson from the Department of Family Services. Again, we brought these folks to this webinar today and throughout the rest of this week to be able to answer your questions, because we're going to be exploring orders 1 and 3 and the changes therein that will occur on May 1st as these current orders lapse on the 30th. So if you jump to this next slide, Warren, what we'll do is we'll take a quick look at what we'll be covering today. And again, I think we want to stress, and I think everyone can understand, that there have been plenty of folks who are saying we need to be open, and there are plenty of folks who say we need to slow this down. And really, you know, in some ways, you're both right. It's a tough balancing act. And so I know that our governor and our Department of Health have been working very, very hard to make that possible and to do it in the right way. And so we're going to be taking a look at those health metrics and have either Stefan or Stephanie do that here in a minute. We're also going to take a look at some options that the businesses that were always open and maybe in a limited capacity, but they were always open, take a look at a couple options for them. We're going to dive deep into how Order 1 affects the new childcare restaurants and dining, gyms and fitness, and then how Order 3 changes for personal services. And then we're going to also take a look at what's called a variance or exception process, so that those counties or businesses within the counties can ask for and perhaps, depending on the process, perhaps get a variance or an exception to these guidelines. I do want to say, and this is something that we'll reiterate throughout the entire webinar, is that we obviously are taking health metrics first. And while we are relaxing things at this moment, we want to make sure that everyone understands that it's going to take a close collaboration with your customers and making sure they know what the expectations are and that we do this in a safe way. Because if those metrics change, we may need to change the guidance again. And in some ways, it's possible that it could be more restrictive depending on those metrics. And so we just want to impress upon everyone that this is a step in one direction, but it does not indicate that it will be that way forever or that it will be moved faster that way, and that we'll be doing this in a data-driven fashion. And then finally, before we move on to taking a look at those health metrics, we do want to impress to everyone that, working together and trying to understand these is important. And there have been some challenges understanding some of these. But what we will say is the changes that we're mentioning today, if you meet those guidelines as they are written and as they will take effect on May 1st, you may open without having to reach out to the county health officer or the state health officer or the governor to get that approval, if you meet those guidelines as they're written today. And we'll talk through that a few more times, but it can be a challenging concept. And with that, I'm going to turn it over to Stephanie and Stefan to talk a little bit about the metrics that we're using from a health perspective.
Very good. Thank you, Josh. This is Stephanie Pyle. I'm the Senior Administrator of the Public Health Division at the Wyoming Department of Health. And I think I am not able to see that metrics screen. Warren, can you perhaps make that a little bit bigger? What I'd like to do is really start with just kind of an understanding and an impression upon the participants on this call that we do understand the difficulty of the circumstances that we find ourselves in. And we are taking all of these things into consideration. Our job at the Department of Health is to protect public health and to look at what measures need to be in place so we can make sure we're moving in the right direction as we all work through these challenging times and times that we have not previously experienced in our lifetimes. This is something that we started working on before the outbreak started occurring in the United States, and that we had measures in place to deal with these issues as they came to us. So many times we've been asked the question, when can we ease restrictions? When can we reopen? And to Josh's point, there has been a lot that has remained open over time, but knowing that there are some businesses that have not been able to operate. So rather than looking at a date in terms of when we will reopen or ease more restrictions, we're looking at data, and we're taking a data-driven approach and a measured approach so that as we move forward to the greatest extent possible, we can continue moving forward and not have to go back, as Josh mentioned, to tighten restrictions again. Really, that is the last thing that any of us want to see. We really want to see progress moving forward. So to that end, this is a high-level overview of the metrics that we will be looking at in conjunction with the governor's office as we make recommendations in terms of moving forward. So the first metric that you see on the screen is new cases. Have there been fewer cases over time? You'll see that the current ranking of this is concerning because over the past several days, well, actually every day, we've seen an increase of cases. And so this metric is concerning because we do continue to see those new cases every day. The percent of cases attributed to community spread. So, clearly we want to see this metric improving. We want to see fewer cases attributed to community spread. And really what this means is, of those individuals who have tested positive to COVID-19, can our epidemiologists track down how they were exposed and where that exposure occurred? When there's community transmission, it means that we can't clearly define how that person contracted the virus. And so that is concerning because that means that more and more people will be exposed. and it's more difficult to track the origination of that. And so this is stabilizing, but we want to see it continue to improve. The next metric here, percent of all tests that are positive. Is the percentage the same or less? So as we look at this, we're about at a 4% rate here of all tests that are positive right now. We don't want to see that increase. We want to see it really remain about the same. And that's so we know that fewer people, as testing capacity increases, we want to make sure that we're not seeing more and more cases and see that percentage increasing. So that is stabilizing. Next, we go to the other set of metrics here, and this really looks at our hospital capacity. So the first one here, total COVID-19 admissions reported by hospital. Has there been a sustained reduction in total COVID-19 hospitalizations? That's what we want to see, and you'll see this in some of our metrics. And this is information that's reported to us on a daily basis that we're keeping track of, with hospitals reporting this information to us. And it's really important to track this because it tells us of those patients who are COVID-19 positive, how serious is their condition, and is it serious enough that they're having to be admitted to the hospital? And this takes us to our next two metrics, the total hospital bed availability and ICU bed availability. It's really important that we keep an eye on this. As you know, we do see the number of cases increasing, and if people are becoming ill enough to have to go to the hospital, we need to make sure that we've got an eye on these two metrics so that we can plan for any surge capacity that's necessary. Currently, our numbers are looking okay, but this one is a really important one that we have to keep an eye on, because if we do have that increase in the need, we want to make sure that we can address that need and that we can help hospitals in this area so we don't have individuals who are in need of hospital beds or ICU beds who don't have that availability. So we're tracking these metrics daily. This information is available to counties as they work through these issues. It's available to them on a daily basis, and the counties are working with our epidemiologists to continually analyze this data to see what it's telling us to inform our decisions as we move forward. So thanks, Josh.
You bet. Thanks, Stephanie. And Stefan, anything to add there?
No, Josh, thanks for including me on these webinars. The only thing that I would really add is what has frustrated a lot of people is tying these metrics to specific actions is very difficult. We don't know a whole lot about this virus. Nobody does in this country, even internationally. We're learning more and more every day, but what we have to do at the Department of Health and at the governor's level is we have to look at this situation and these metrics holistically to see, both on a statewide basis and holistically on a countywide basis, how much do we feel we can take on risk of easing restrictions or need to put additional restrictions in place based on what we're seeing across all of these metrics. So I would caution folks on putting targets around, for example, when we see a certain percentage reduction of new cases, does that mean that we fully open restaurants, as just a random hypothetical example? The answer to that is likely no. We really want to see more, to put it simply, more yellow and green across all of these different metrics, and not only on a statewide basis, but in the counties that have varying situations across the state. So that's why Stephanie mentioned we're looking at this statewide. We're also looking at it on a really targeted basis because we know this is not one size fits all across Wyoming. Natrona County is very different than Weston County right now when it comes to the outbreak, when it comes to new cases, when it comes to hospital capacity. So we're trying to be as targeted as possible, but would really encourage folks to be with us when we say we need to look at everything together when it comes to administrative and legal decision making around these metrics. Thank you, Josh.
Yeah, thanks, Stefan. All right, so let's move on to the next slide, and a couple of these slides are really kind of critical from a perspective of businesses that are remaining open and that have been open. Let's take a look at this. So the Business Council over the last few weeks has put together a website with a map and listings of businesses, and it's at wideopenwyo.org. And ultimately, what we want to do is get all of the businesses in Wyoming listed here with your updated information, because we know that your hours are changing. We know that your availability is changing. The services that you offer are changing. We also know that you want to be able to find and perhaps find the urgent care centers, and as things move forward, maybe testing centers. So yeah, to that end, we put together this website, and we're taking in listings from businesses. And you'll notice at the kind of the top right of the slide and of that screen, you'll notice that there's a place to add a business. And so we want to make sure that we're getting that information in. If you click that and provide the information for your business, we'll be able to vet that information and then post it live so that people can use it. It's also a good reminder for all of us business people to think about the information that we're providing out to our customers via our social media outlets, Google search engine, and through our website, so that we can make sure that we're providing the most up-to-date information. And of course, I'm sure you're doing that, but it's just a good reminder that those channels are very important, and updating your service offering as well as your hours is critical during this time. As we move to the next slide, I just really wanted to highlight this particular website. This is a website that our Main Street manager, Linda Klink, found for us. She attended a webinar, and this was actually done for one of the southern states, but it's got some really good tips. It's got some great information for you to look at, and it's called reopenmainstreet.com. And what I liked about it is it took the various different types of businesses, whether those be retail, whether those be service oriented, and restaurants and food service, and really said, here are some things that you can do, and took a bunch of best practices and put them together. And the key here is, no matter what the situation is that we're facing, I think collaborating with the other businesses in your town, trying to find unique and different ways to operate your business and different business models that you can explore is really key right now. And so I just wanted to remind everybody to, every once in a while, take a look outside a little bit, try to understand what other organizations and businesses are doing to handle this challenge. And this, in my mind, was a really good example of that. So with that, we'll jump to the next slide and dig into the deeper part of what you really all came to see today, which is the orders and how those are changing. And so to that, I'm going to bring in Nikki Anderson from Department of Family Services, and she will discuss a little bit about the child care changes and then be available for questions later. Nikki?
Thank you, Josh. Good afternoon, everyone. I'm Nikki Anderson, Child Care Licensing Manager for the Department of Family Services. I hope you can all see the requirements for child care providers from the new public health order on the screen. Let me first start by saying we know child care is an essential part of the infrastructure of Wyoming, allowing essential systems to function. And as such, child care has been an interesting function since the state has begun to respond to this outbreak. Child care has been impacted in a different way. Not all child care was required to completely close. Many have been able to remain open to serve children of essential personnel. The new public health order allows for child care to reopen and or expand who can be served, keeping in mind children of essential personnel are still a priority for service, and keeping in mind the health and safety of children, families, and staff. We encourage child care providers to reach out to their local county health official to get guidance on the application of the public health order. The public health order is different than our child care licensing rules, and because of that, we recommend that child care providers contact their licensor for technical assistance as you begin to operationalize the public health order and reopen.
Nikki, excuse me, this is Warren. We're getting some comments. Could you move a little closer to your microphone so our audience can hear you better?
Oh, yep, I'm sorry. We recognize some of the requirements may be tricky, and there's some gray, but there are child care providers who have remained open and who have found creative ways to meet the requirements and keep children and staff safe along the way. Your licensor may be able to connect you with a provider who has been operating and figured out ways to meet both the requirements of the public health order while still meeting the needs of children and families. Finally, I want you to know that we are developing an FAQ with all the child care questions from these webinars, and we'll make it available to all child care providers, as well as posting it on our BFS website.
Thanks, Nikki, and we'll definitely have some questions, I'm sure. And just one of the questions that has come up in the previous webinar, and then I thought of now, is that we did put this on the screen. Hopefully, some of you can see it. We realize it's a little challenging to see, but at the end of the webinar, we have a link to the orders, and that way you can look at them there and see the exact order as it's put out. And this is helpful to talk around, but at the same time, we understand that it may be a little small to see. And so we provided a link at the end of the webinar that will allow you to view those orders as they're written. All right, and with that, we'll move on to, I believe next is a little bit about restaurants and some of the changes that are coming there. It looks like for the most part, there's a change in the number of people that can be inside to pick up food and beverage. But to talk through some of the logic behind that and to help everyone understand the reasoning, I think Stephanie and Stefan can really add some color commentary to this.
Thanks, Josh. So in terms of how we approached this easing of restrictions process, we really did want to take a measured approach so we could analyze each new element that was added back into our day-to-day operations. And one of the critical areas that causes transmission of this virus is large gatherings. And so what we know in terms of restaurant operations is there's a lot of people. And so I know we're getting a lot of questions about why weren't these restrictions eased and why were the other ones? In terms of being able to control numbers of people that are in a location at the same time, we are expanding this slightly, which I realize it's a very slight expansion to, allow pickup service again in person where individuals from the public can go into the establishment 5 at a time, as you see here on the screen, maintaining that 6 feet apart requirement. And so this is a precautionary measure that we're taking where we're not reopening restaurants in their entirety, and we do have to take a very measured approach as we go down this road due to the number of people, the types of activities that are happening in a restaurant with people consuming food and drink, and a lot of potential transmission, by way of, people interacting with one another. As we go down the road, we're certainly looking at how restaurants, how we can continue to ease those restrictions and what that may look like. But really at this stage and where we are, the gathering of people, the types of activities were one of the things we were looking at in terms of restaurants. And so now the new, activity that's allowed, as I said, is up to 5 members of the public going inside, maintaining that distance of 6 feet apart.
And Josh, this is Stefan. If I could just add to that, and I know there's a lot of concern, and I saw a question come in on the chat that, when do we anticipate opening up restaurants? And I'll be happy to give that frustrating answer, which is we don't know yet. What we do know is the orders that are going to be continued as of May 1st will be on a 2-week lookout. So they go through May 15th, basically, as they are right now. I know we're going to talk about the countywide variance and the exception request process here in a little bit, so I'll hold off my comments on that. But just to double down on what Stephanie said in terms of the public health logic on these easing of restrictions, you'll all recall that we had 3 orders in place. The first were really businesses that solicit large gatherings, so restaurants, bars, schools, daycares, etc. The second order was kind of general large gatherings of 10 or more, so public events, things of that nature. And the third order were those unique sort of personal care service businesses that represent somewhat of a more unique public health risk in terms of high touch businesses, hair care, massage parlors, that kind of thing. Because of the small amount of people that are typically served in a personal care setting, whether it's one-on-one or whether it's a small shop, the logic is really to back up kind of in reverse order. And that's why you saw order number 3 really seeing the most easing of restrictions as of Friday this week in terms of salons, nail salons, even tattoo parlors and and those personal care businesses being allowed to reopen with certain restrictions in place. The real public health risk, as Stephanie mentioned, is transmission, and that's when you get into the restaurants and the bars and the communal settings that really do pose a risk, where we see a resurgence of any type of virus, and especially with COVID-19. So to be a little bit more direct, going back to the metrics that you saw earlier on the governor's dashboard there, when we start to see a sustained reduction in the daily cases, which we have not seen yet, that is what will really inform it. And there's not a day, there's not a trigger that I can tell you right now, unfortunately. But when we start to see that sustained reduction for multiple weeks, as we approach May 15th, that will be the next step. Is we did the personal care services, some easing of restrictions on gyms with some pretty significant guidelines there. But the step number 2 will be looking at the rest of order number 1, which has restaurants and bars and other types of businesses that have larger gatherings, and looking at easing restrictions if the data supports it. With some social distancing, with some safety and sanitation precautions in place. That will be step number 2. And then likely step number 3, when we're really seeming like we're performing well and those metrics as a state or on a countywide basis, then the last thing that will likely go or be lifted is gatherings of 10 or more. Because as Stephanie mentioned, that's really the unique public health threat when we talk about the spread of this virus, which we know our numbers are low, relatively speaking, in Wyoming. But we've had 7 deaths, and those are folks that we know. Those are folks that are our neighbors and our friends, and that's what this is all about, is knowing that not everybody's going to get sick, not everybody is going to need hospitalization who even gets the virus, but for the folks who are uniquely susceptible and potentially require a higher level of care, that's what this is all about. And we understand it's tough, and there's nothing I could say to ease everybody's concerns about the economic implications of these decisions. But as Josh mentioned before, there's not an hour that goes by in a day when we're talking about this in the Department of Health or with the governor or his staff or Josh and the other agencies that we don't think about this balancing act of the economic impacts versus the health impacts. So happy to answer any more questions on that, Josh, but just wanted to double down on what Stephanie said. Thank you.
Yeah, thanks, Stefan. And I think that is, it's really key for all of us to keep that top of mind. And we'll jump to the next part of order 1, which I think deals mostly with fitness centers and gyms. And, I'll speak briefly on this. I was joking around this morning that I've seen the inside of a gym. I'm not a gym owner, but I've been in a gym. And so we don't have any necessarily representation directly from a gymnasium, but Stephanie and Stefan will be able to chime in as well on this. But, there are a few key components here that, things like the staff needs to wear face coverings at all times. And then, like many other situations, that management needs to ensure that no employees present symptoms of illness, and making sure that they go home and they're not permitted to work. A couple of the things that are really critical here are the close contact activities, like one-on-one personal training and weightlifting that requires spotters to keep that social distancing aspect in place. Locker rooms where some congregating can occur need to remain closed. And then thinking about the social distancing and workout equipment, you've got to make sure that equipment is spaced 6 feet apart, at least 6 feet apart. And then it needs to be cleaned by staff in between usage by customers. And we had a question on that earlier today. And somebody said, hey, well, can the patron just go ahead and clean it after they use it? And the challenge there is that in most cases, we hope that the gym staff has been trained on how to appropriately clean it and do it in a way that is ensured the quality of cleaning that is necessary to take care of this. And so it does need to be staff in between usage by customers. And so that's really important. And then the other part that it can be challenging or interesting is the no more than 9 people in a specific room or confined space at any given time. And so you'll have to take a look at the layout of your gym and the spacing of that, and ensure, again, that social distancing. And then finally, the thing that I think I'd want to cover more than anything is the idea of keeping a record of the customers and their time and how long they were there, so that the staff, the customers, everybody is logged on their timing and everything, in case contact tracing is important and necessary to do if there is a bit of an outbreak, or to track that back. And so with that, I'll turn it over to Stephanie or Stefan to add anything to that. But that means gyms are open if you can meet these guidelines, and then Stephanie can talk a little bit more about that.
Sure, thanks, Josh. And just to emphasize, I know that it's hard to keep track of all of these things, but remember that the orders that we're talking about now take effect on Friday, May 1st.
Yep.
And so I'm sure that there are a lot of people who are preparing for this. And so one thing that I do want to emphasize is, and Josh mentioned this at the beginning of the call, but if you're a gym owner and you can ensure that all of these things can take place starting on Friday, May 1st, you can open and open in the limited capacity that's delineated here. These orders, as we've said, are available on multiple websites, the governor's website, the Department of Health's website. And so I'm sure as you're going through some of these things, you might start to think about more questions, and we're happy to answer those if you don't necessarily have the questions today. But these are the guidelines. And so if you can meet these guidelines, you can open in that limited capacity on Friday, May 1st.
Thanks, Stephanie. And again, I think that's a key component. We'll go ahead and reiterate it in case people might have missed that at the beginning. The current orders are still in effect until April 30th. And then on May 1st, these new orders will take place. And if your gym or, as you'll see in a moment, your barbershop or restaurant meet these guidelines, you can then reopen in that limited capacity based on these guidelines. You don't need to you don't need to get any permission from your county health organization. You don't need to talk to the state health officer or anything like that, or the governor. You just need to go ahead and reopen in the limited capacity that is listed in the orders. But again, and then we'll talk about it later, if there is a need for an exception or a variance, we'll talk about the process for that. With that, let's jump on to, I believe it's order number 3 now, where we can take a look at this. And before we dive into this, with our folks from the Board of Cosmetology, I did want to mention that we are taking the questions in the Q&A portion of the webinar, and we'll be taking a look at those as well as any questions that might be live. So we'll go ahead and jump into order number 3, and I believe we have on the line Sharon Bennett. Sharon, if you could take a stab at these, that'd be great.
Thank you. First of all, I just want to echo what everybody said here. We're receiving a lot of calls. The order says if you meet these guidelines, or not guidelines, restrictions, you can open on May 1st, but it does not say that you have to. And so this is a lot to get ready in a very short amount of time. So we're just trying to stress to salon and barber shops, take your time and do it right. Make sure that you are able to meet every single one of these requirements to keep your people, yourself, your families, your community safe. We're here. We'll try to do our best to answer your questions regarding these orders. And if we can't, we have great people that are going to help answer them. Our rules and regulations for infection control have always been the same. They'll always be the same. They are just more important now than ever. We have more information on the website, just some recommendations before opening. And again, we are here. Anybody can call. We'll get those answered. I think the biggest question I'm getting right now, and I'm just going to put it out here and then maybe see if Stephanie could help me with this, is that at no time shall more than 9 customers be in a confined space. A lot of our salons have separate rooms. So you have a large building with an open area that may have 6 styling chairs. They understand in that room it's going to be one-on-one with them and their customers, but they also have individual treatment rooms. So are they allowed to have in the open area under 9? 9 or under, and then in the separate treatment rooms be one-on-one with people, as long as they're not congregating in any waiting area?
Yes, Sharon, I believe that would be appropriate. And I think the main issue here is not having all of those people in a confined space. So the way that you've described it, with those limitations, I think that your licensees would be okay.
Okay, perfect. And then I'll just step back here, and if anybody has any questions, I'll be happy to answer them.
Thanks, Sharon. And, I think that all of us feel the same way about, reaching out and making sure that people can get their questions answered. I know Stephanie mentioned it in the previous webinar, and Sharon, you've been very gracious in saying, hey, make sure that you reach out to us and get your questions answered if you need to. And of course, if you know of people who are going to be in these same situations over the next few days, please have them attend our webinars, and we've got contact information at the end for the Business Council as well. With that, we're going to take a look at the exception and variance process, and I'm going to let Stephanie walk through this. She understands this very, very well and can walk us through what this really means. Stephanie?
All right, thanks, Josh. So this has been an area where there is a little bit of confusion. And so I want to try to dispel the confusion right from the very beginning. We have extended the statewide orders starting on Friday, May 1st. With that, we do recognize, as we're taking a statewide look at this data and evaluating things statewide, there is also the opportunity to evaluate things on a county-wide basis. And counties are varying, pretty significantly in some cases on their metrics. And so we know that what might be appropriate for the whole state may not necessarily be appropriate for a county, depending on how their metrics are looking. And so what we have made sure is in place is that counties can look at the statewide order and say, our county is different, our county metrics are different, and our county metrics are such that we think we should vary from the statewide order. And maybe they're going to say we should have more significant restrictions, or maybe they're going to say we should have fewer restrictions here. So this is an opportunity for a county to vary from the statewide order and say our county should operate in this manner, which is different from what the statewide orders currently indicate. So that's varying from the entire order for the entire county. Then you switch over to the exception. The exception is where, from a business owner perspective, you would probably be more focused, because maybe you're saying, I'm a business, I think I can operate, and I have a plan to operate in this in a manner that recognizes all of these provisions of social distancing, of, potentially keeping track of who's coming in, of screening, and all of these different elements that I think I can accomplish as a business owner. And when you think that's the case, you can contact your county health officer for an exception. So we have the two different processes. One is a variance, where a county is saying we want to vary from the statewide order in this way as a county, and the other way for the small business owner to say, I want to seek an exception for how I can operate and accomplish some of these things that you've heard on the call today that need to be accomplished. Now, whether or not it's a variance or an exception, when you look at step 3 here, the county health officer has to approve either the variance or the exception, and these conversations should be taking place at the local level, where the county health officer is talking to the elected officials, talking to the other public health providers, and really getting a sense of where are we as a county on these things. Then the county health officer can make an informed decision based on data, based on the conversations happening at the local level. And then the county health officer can make a recommendation and talk through that with the state health officer, who has to approve either the countywide variance or the exception. We do that in conjunction with the Attorney General, and then can get back to the county to say your variance for the countywide activity is approved, or the exception for these this particular business or these particular businesses is approved. So we're trying to find a balanced approach with this, just as we are with the other activities that we're doing, where we don't necessarily think there's a one-size-fits-all approach to this, and we want to give counties discretion, you know, at the local level to talk through these things, to look at their metrics, and to make informed decisions that might be more appropriate for their county, other than what's indicated in the statewide orders.
Thanks, Stephanie. And another thing to think about with this, and I think this is really critical for communities with, you know, with multiple organizations, say for instance, gyms or restaurants, that, you know, thinking about the process and how it would work. I don't want to use the term bottleneck, but it is going to may quickly overwhelm many of the folks that are listed on here, the county health officers, as well as the state health officer. And so one of the things that you might want to consider if your businesses and you're thinking about exceptions and that is to reach out to businesses that are similar in your community and maybe talk through what might be something that could be global, because we would hate for 27 different plans to hit the county health officer's desk and all of them really kind of be asking for the same thing. So I might urge businesses that are considering taking this to look out to some of your the other businesses that are similar within your community and think through how you can look at it from that perspective and making sort of a more global request at your county-wide level rather than the individual exceptions in your business. And of course that brings its own challenges about, but I want to throw that out there as a potential way to make it a little bit easier on the process and make it so that it will perhaps even handle some of those cases that maybe you're not thinking of. So Stephanie or Stefan, is that a course of action that you would say might help?
Yes, Josh, I do think that's a good suggestion. When we can kind of streamline these things to the greatest extent possible, I do think that's a good idea.
Okay, great. So with that, we're going to move into, again, I think these have all been very, very helpful. And now we're going to talk a little bit about the questions and answers. And I'm going to go ahead and go through some of these. As Warren mentioned at the very beginning, we're going to be asking you to, if you would like to ask a question live, you can simply raise your hand and we will we'll take the questions that way. But to get us started off, I'm going to ask a few questions from the chat, or not from the chat, from the Q&A, and make sure that we can take a look at those. We may not get to all of the questions today. I apologize for that, but we will be taking a look at these one by one and making sure that we take care of them and get you answers as fast as possible. So, this is a question, I think this ties right into gyms and fitness centers. And again, I think this is a good thing to clarify. It says, how does this affect community rec centers that have gyms, weight rooms as pools, as well as schools that have these same facilities? Stephanie and or Stefan, do you have any comments on that other than basically looking at the guidelines as they are and seeing how your particular facility fits?
So thanks for that question. I would say for the rec centers that those would fall into the components for the gymnasiums. As far as any schools that have those types of facilities, pursuant to the statewide orders, school buildings shall remain closed through May 15th. That's in order number 1. So I think if we're talking about using that type of facility within a school, that building is still closed through May 15th.
Very good. Thank you. All right. So here's a question about a nonprofit museum and gift shop. And they're asking when we do open up, will we need to take the temperatures of not only our volunteers, but of our visitors?
So that is a good question. So currently under the orders that we have, and Stefan can jump in here if I misstate anything, I don't think that the question that's posed here is covered in any of the provisions that we have within our orders. Having said that, I do think that the suggestion here, or the question, is a good practice as you open up, in terms of keeping your staff and your visitors safe. However, as I'm remembering the orders and all the provisions, I would not say that that particular requirement would be applicable to a museum and gift shop currently.
And Stephanie, this is Stefan. The only thing I would add there is, and I think you're absolutely right, there's a difference between what's ordered and what might be a good practice depending on the business. So I go back to our guidance to grocers and retailers on, to the extent practical, screen your staff for symptoms. Folks who say they're not feeling well should be sent home immediately. But there's nothing specifically regulating businesses that need to have thermometers, for example, and screen everybody that comes in. We understand, that we need to balance the urge to micromanage with the reality of the situation and let our businesses comply with the orders and also make the best decisions to keep their staff and their patrons safe. The second thing that I would mention is on questions like that, we can't always count on Josh to do one of these great webinars, but on questions like that as the days and weeks unfold, work with your county public health office on any issues related to interpretation of orders or any sort of restrictions or questions that you have about those restrictions. Because again, we're trying to tailor this as much as we can to the varying situation in counties while knowing that we also need to have a statewide approach. So when it comes to things that a county health officer may have already allowed or an exception that may have already been granted that you might not know about as a business, your best source of information locally and on the ground will be your county public health office on those types of questions. Thanks, Josh.
Yeah, and there are a few questions here that I think really kind of tie into that and might be good for us to take a look at. First and foremost, we talk a lot about exhibiting symptoms, and is there like a little cheat sheet or a card that says these are the common symptoms, and where would that be available?
So thanks for that question. And one thing I've determined today is that type of guidance would be helpful. So we'll be preparing that. But just to generally answer the question now, some screening questions that would be helpful is whether or not the person currently has a fever or feeling feverish, a fever of 100.4 or higher, chills, a new or worsening cough that the person can't attribute to another health condition, new or worsening difficulty breathing that the person can't attribute to another health condition, sore throat, new or worsening muscle aches, new or worsening headaches that are not normal for the person, a loss of sense of taste or smell, and in the last 2 weeks, whether or not the person has had close contact, within which close contact is defined as within 6 feet for at least 10 minutes with anyone who has been diagnosed with COVID-19. So those are some screening questions that we can definitely put into a guidance document that can be used as a tool as we're implementing some of these requirements for screening of staff, et cetera. So that can be something that's available. We'll make that available on our website.
And Josh, during the last month or so when these orders were put into place and a few guidance documents have been released, to childcare providers, to, like I mentioned, grocers and retailers, educational institutions. One thing that I'll mention, and Stephanie, we can certainly include this, both give it to the Business Council for distribution as well as maybe a general guidance document along these lines. The CDC has some really good resources that we can link you to when it comes to signage for your business, for these types of questions. If you're feeling sick, here's what that means, and also social distancing signage, posters, helpful one-pagers that you can hand to your staff. So we'll be sure in the development of these guidance documents to make sure we link you guys directly to that.
Great, thank you. I have a couple more questions that I think would be pretty important for really all of these orders, and that has to do with, and this came up in our first webinar as well, Stephanie, does staff count as part of the 9 people per room, or really just, I guess, in a more general sense, does the figures that we provide include staff and patrons?
So yes, and specifically this came up with regard to childcare. So and the distinction here, and Nikki, please jump in. on this if necessary. But when we're talking about the number of people in a room, this is slightly different from how this is calculated from a staff to child ratio under the DFS rules for childcare. So when we're talking about these numbers of people, that does include each person. And so whether it's a child and the staff member or the people working in the location, we're talking about number of people, not a staff to child ratio, for example.
Okay. So, and obviously not a staff to patron or a, the employee type of situation. It is total people in that area.
Yes.
Okay, very good. And another question here, is there a template for contact tracing available on the state website for the information that needs to be collected?
You know, we don't have that type of template. And if there is the need for contact tracing, that's something that our epidemiologists or our partners at the county level will do. And so we're certainly not asking for individuals to do that. If we're talking about simply a sheet that, a person can put in their business, I think it can be very basic, name, phone number, information like that. But I hope we haven't given the impression we're expecting any businesses to do that contact tracing. If there is an outbreak, that's something that we, our epidemiologists will do in conjunction with some of our local county partners.
So the businesses need to keep track of who has come for that, but they will not need to perform that activity if necessary.
Yes, that is correct.
Okay. We do have a question that we could take live. Candace Machado, let me see if I can allow you to talk, Candace, and ask your question. I believe you had some questions about either yoga or a fitness center.
Yes, hello. I don't know if you can hear me.
We can, yeah.
Okay,
thank you.
wonderful. Thank you for taking my questions. I just needed some clarification. I own a yoga and meditation company here in Casper in Natrona County. And I just had a couple of questions because yoga studios and or meditation centers normally run off of small individualized settings. So my company runs off of classes that are 10 people or less at all times. And we always require that people register because we don't do a lot of walk-in type of things. So I just needed clarification on, does that mean that we can't open because we primarily work under small class sizes? Or does that mean that we can open since we would be under 9 people and we would be following all the other restrictions with face masks and things of that nature? And can we have classes outside?
Candace,
thank you for those questions, Candace. Yes, Stephanie?
Yeah, thank you for those questions. Candace, so the questions that you pose are complicated, but I'm gonna answer the easiest one first. If you want to have a yoga class outside, you can. And if it's not in a confined space, you can do that. The other questions you pose are a little bit more complicated because we're talking about then we are in a confined space. For example, there could potentially be that close contact. So I think in talking through this, there may be some additional questions that need to be answered in order to give you a definitive answer. So for example, can your patrons maintain at least 6 feet of space? What about, any yoga mats that they might be using or interacting with one another, as the class proceeds. So things like that we may need to take into account and really think through this and how you may be able to do this and what restrictions may still be in place. So I know that's probably only an answer to one of your questions, but some of these other things, we need to ask more questions before we can answer.
Yeah, and Stephanie, just maybe this leads to and could cover a number of the questions that are in there about karate classes, jujitsu classes, dance classes, and I'm not trying to lump them all together because I realize they're all a little bit different, but in the way that they interact with a building, for example, and with those classes, perhaps they're similar. So would that be an example of kind of banding together and trying to understand how you might talk with your county health officer or public health to perhaps get a variance or something like that? Would that be a good example of that?
That would be a good example. And in fact, just having that conversation with the county health officer to kind of talk through some of these things and evaluate that based on the location, the space. So that's an excellent place to start, for one. And second, yes, to say, who might be in a similar situation that we can kind of have this broad set of questions answered specifically for these operations within our county. So those are both really great suggestions, Josh.
Let's see, we've got about 5 minutes left, so I want to take a couple more questions, and these deal maybe not specifically with orders 1 and 3 as we've taken a look at them today, but they are very critical, I think, and could deserve a good answer. So one of these questions has to do with public camping spaces, and while again we didn't cover that, the question of when those would be available and open back up. Do we have any, do you have anything on that, Stephanie?
Yes, I can speak to that a little bit, but simply to say that I know that State Parks is in touch with the governor's office and with us for some guidance on that. So I do expect some information to be forthcoming on that this week, potentially in the governor's remarks today that he'll be offering. But certainly we're working with State Parks to get a definitive answer on what will be permitted moving forward with regard to campgrounds.
Okay. Stephanie, also, if here's a question about employees from out of state. So it's from Kelly, and it says, do our employees need to quarantine for 2 weeks when they show up from out of state?
So good question. And so this is referring to the order that the governor issued, or the guideline, the executive order from the governor. If a person is coming into the state for work purposes, they do not need to self-quarantine for 14 days.
Very good. Very good. Thank you. And then let's see here. This question is from Bethany, and it is, do you have input on opening back up a day program for individuals with disabilities? We are looking at the regulations of a daycare facility, but we do work with a more vulnerable population. So just curious if this has been discussed or if there's more guidance that you could provide.
I think, Josh, this goes back to what you mentioned before, and speaking with the county health officer about that, talking through some of those specific questions and issues that are presented in dealing with a more vulnerable population. So I think having that conversation with the county health officer would be a good starting point.
And Josh, this is Steph, I would just add, that's a great question on services for folks with disabilities. If you're under, regulatory authority from Wyoming Medicaid, for example, that's another place to get specific answers to questions on regulations regarding reopening, as well as reimbursement, that kind of thing. If you're a disability service provider, that's under Wyoming Medicaid, which is also under the Department of Health. So I think Stephanie's right, county health officer and any of your state and federal partners are ready to answer those kinds of questions. I think it's a very unique situation, like you mentioned in the question, when you're working with a vulnerable population, whether that's a long-term care facility or folks with disabilities, folks with underlying health conditions, it is higher risk, like I mentioned before. So it's really important to take a measured approach and get those questions posed to your county folks and to your state and federal folks that might be able to help you work through those decisions on reopening.
Excellent, thank you. I think we have time for 2 more questions. We're going to take one live, but I also got a number of questions about bowling alleys, and the question there is, can I open up my bowling alley and assign lanes and keep people 6 feet apart, can I operate the bowling alley without food and bar service?
So good question. You know, I'm thinking through the provisions in our order, and I believe this would be acceptable. I do think that the operator of the bowling alley should take special precautions in terms of hygiene, sanitation protocols, making sure that all of those things are in place. Also keeping in mind social distancing and, you know, all of the things that we've talked about. But at first, you know, thought in terms of a bowling alley, I believe that would be permissible.
Okay. So we have time for one more question before we need to adjourn. So I'm going to have Candace Dooley ask her question. Candace? Candace, I've unmuted you here, but it's possible that you're still muted on your computer. Well, it looks like we're experiencing a bit of technical difficulties. Sorry about that, Candace. We're unable to take that question. But I will
Josh,
say,
I'm sorry, this is Stefan. I would just offer that, and we really appreciate you guys doing a series of these webinars. And if it at all possible for you or Warren or your folks at the Business Council to get copies of those questions, not that we can directly answer every one of them, but that's going to really help inform any guidance documents that we put together, where we can see kind of what are the common themes. Because just looking through the Q&A and the chat box right now, just some really good and insightful questions, some of which we have very readily, easily available answers to, but others that, again, are more nuanced and complicated. So if we could see that list, and not to put you on the spot, that would be fantastic.
Actually, Stefan, that's exactly what we will do. Is we will take this list of questions, we will divvy it up amongst the agencies that are most appropriate and get answers to those. As Nikki mentioned earlier, and as Sharon mentioned, they're taking a look at those and not only informing their own guidance, but also putting out an FAQ as well. And really, I guess that brings us to a close here. And I want to thank all of the panelists for coming and taking time to help explain these. And also, you know, really more importantly, I want to thank everyone for joining today. I think it's very encouraging to see this much activity and see people really eager to get back to work and to help their businesses get through this. I also really appreciate that you are taking an approach of trying to understand and trying to work within this. And I do want to make sure that everyone really thinks about their community and collaborating with their other businesses within their community and within the state, and then thinking about the creativity that you can bring to this in order to meet these guidelines, but also to make sure that your business is healthy moving forward. Because in addition to thinking about public health and making sure that we take advantage of and take care of lives during this time, we also want to take advantage of this time to say, how can I run my business differently? How can I serve my customers better? What are some ways that I can help myself through the other downturns that may occur? And I really think by, you know, having a sense of community, having a sense of collaboration and creativity with those folks who maybe at some point were competitors or partners, we just want to make sure that we work on this together and get through it. Please let your friends and other people within your community know that we'll be doing these webinars at 8 a.m. and noon for the next 2 days to answer any questions. And we sure appreciate your time today and look forward to continuing to serve you. Thank you.